most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Tripped a little bit over my words there, Brad. Today we're going to talk about 3 big lies about your neck arthritis pain, also known as cervical spondylosis. We're going to show you how to stop it too.
Right, yeah. It's the more you know about it, the better you feel.
Right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, go to the giveaway section. Always giving something away. This week, a doozy.
Yes.
We're giving away a Sleepovation mattress. I'll talk about that in a minute. Go to Facebook if you want to find the contest. It'll be pinned to the top of the page. Go to Twitter, Instagram, and TikTok if you want a 60-second version of our program.
There you go.
So, yeah, this week's giveaway, it's this is a sample of it. It's obviously comes in a larger size. And it normally has the cover on there. You can't even look at this part of it.
Right, it's all enclosed Sleepovation mattress.
Yep, and it's got 700 individual mattresses, and it's got air channels, and it's, I would say, the most comfortable mattress I've ever used by far. Yeah. It's very good for pain control. You want to take care of it?
Oh, absolutely.
All right, let's first define cervical spondylosis. So that's just really a general term for age-related wear and tear affecting the spinal disc mainly. And
cervical is the neck.
Yep, cervical is the neck. And the discs are in between the bones. Maybe you should show that, Brad.
Well,
you want to grab that spine right there?
Yeah, this one's handy dandy. But yeah, it's we got 7 vertebrae in the cervical spine, and between each vertebra there's a disc. And then you got facet joints, so you can allow it for motion and everything that it's amazing what the neck can do.
Yeah, what happens is as these discs start to wear out and there's not as much space between the bones, you're going to start developing like bone spurs. Where the nerves come out, there might not be as much room, and you might get some pressure on the nerve.
That could be stenosis.
Right, and it kind of speeds up arthritis too then, because the joints are jamming together harder.
Yeah, but there's things you can do to help prevent that we're going to talk about.
Right. So let's talk about the big lies, Brad. So I'm going to give a scenario here. You develop neck pain, you're 50-some years old or older, and you go see a doctor, and he orders or she orders x-rays or scans, and you see bone spurs, you see bulging discs, you see more bone-on-bone contact, and you're panicked. You're like, oh my God, my neck is a mess.
Right. I remember my brother went for one of these, and he was like 60 years old, and his doctor said, don't worry, you're going to have, there's going to be things on the x-rays and the scans it's just a part of age. Don't get too excited about it. But
that was nice of him to prepare, because some of them don't.
Right.
Go, oh,
well, yeah, he is a nurse and he worked with them.
Oh, sure. That's why. So, but just to give you something to calm down a little bit, 85% of people over 60 now, this is over 60, have cervical spondylosis. It really is part of the aging process. I'm sorry, if you're getting older, it's going to happen.
Right. It's like getting gray hair. Well, if you get gray hair. I just talked to one guy who's 7 years old and not an ounce of gray hair. He doesn't die. Anyways, let's go on.
All right. So if you get cervical spondylosis, it doesn't mean that you're going to have symptoms. Most people are asymptomatic. They don't even feel anything at all.
Sure.
So that's the big lie. Just because you see these things, that's not necessarily even the cause of your pain.
Right.
It might be shortened tissues and muscles.
Sure.
So number 2, the thought process is always, it's just going to get progressively worse.
Sure.
Arthritis. And that's not necessarily so. One, it may stabilize, kind of stay about the same. It might even improve slightly. They find sometimes arthritis does. So that means, and it certainly doesn't mean your pain's going to get worse, for sure.
Right.
Because you can do things, and we're going to show you that in just a minute. Range of motion, which keeps your neck moving, correct? And of course, posture. It's always posture.
Exactly.
You got that head forward, it's going to put stress on the neck, and in the muscles, and you're going to feel pain. So the third big lie, I need to rest my neck because if I move it, it's going to make it worse.
Right, yeah. If you don't move it, it's going to get worse.
Yeah.
Motion for all this, the whole thing is keep your neck moving as long as your whole body. But here we're talking about the neck. So if you keep your neck still, arthritis
gets worse.
Always gets worse. Tight muscles get tighter. Everything just starts to.
There's no blood flow. There's no nutrients going in,
right.
and waste products going out. So it's all important.
It is. It is, and that's not always clearly informed to people. So
right, get that neck moving in control and non-painful.
Right, we're going to show you some exercises that do exactly that.
Well, the first one we've showed 7 billion times, and that's chin tucks. So Brad,
maybe 8 billion.
Yeah, maybe 8 billion. Look at our new chair here.
That's beautiful.
That's a beauty.
Yeah, it's got some nice armrests. It's a firm chair. You got good posture when you sit in it properly. And we're talking about this simple exercise.
Right. We're not going up. We're not going down. We're going back.
Yeah.
And you're stretching that more in the upper neck is what you're hitting.
Yep, right up here, right below the occipital bone. And you gap in the facet joints, and you may not understand that, but it's separating the joints where there would be arthritis, so you get some of that synovial fluid in there.
So then we're going to do some neck extension. Now, some of you may not be able to do this.
Yep.
But you do a chin tuck and then you start working back. And again, let your neck decide how far you can go. If you're having way too much pain when you get to a certain level, back off and just work in that micro range.
Yeah. If you just put your hands here for support, it can be a big difference on it going further.
Well, we often use a towel too for extension, and that makes a huge difference. So you just put a towel around your neck and pull down. And
should I?
Yeah, if you want to grab it, I'll show rotation while you. So then we got rotations. You're gonna again always make sure you're in perfect posture, like your ears are right over your shoulder, and you're gonna work on going left and right. You can even give it a little overpressure on the chin like this, and overpressure on the chin. I'm a little tight to the left, Brad. And again, if it hurts one direction, just work the other direction, and eventually check it out again.
And the overpressure is not aggressive.
Yeah, just lightly.
Gentle. Here, if you get a towel, this is about as small as you want to get, but it'll work. And I got to grab kitty corner and you roll it up. You can use a belt too. They make yoga straps.
That they work too.
So, but the idea is just something here, and that's why your hands can work sometimes as well. I don't mind either way. And that cushion really can make a big difference. You can go up like this. It feels better. You go further. And then rotation, you can use a towel and get a little overpressure with more comfort.
He switched his hands on that. See that? How he did that?
This is a little bit tricky.
Yeah. It's too small, the towel.
Yeah, you can, with your hand, it works fairly decent with that.
And the final one is side bending. So again, good posture, chin tuck. I like the chin tuck. And then bend to the right. You can take your fingertips, grab the left side of your head, give a little stretch, chin tuck, bend to the left, using my left hand. I don't know if I said that right. Did I say right? Right hand or left side?
Just do it how it looks.
Yeah, do it how it looks. Don't listen to what I'm saying. All right. Yes. So that's it. Keep that neck moving and in good posture, and your pain levels will decrease.
Right. Motion is lotion.
There you go.
Take care.